aging, there are some things you need to know about caring for them. Roger Miller with Synergy HomeCare joining us this morning at 9:42 to tell us the signs of depression and dementia in adults. Roger, good morning.
Good morning. Thank you for having me.
Well, thanks for coming in. These two things, dementia, depression, are they often confused?
They are often confused.
And why is that?
Because a lot of the symptoms are very similar.
Okay.
But it's important to know the differences so you can treat it the correct way.
Well, let's talk first about the warning signs of dementia. We'll get some information here for you.
The obvious one is memory loss.
Yeah.
You know, just common memory loss. I'm not talking about when you forget where you put your keys.
Well, that's the thing. When does it become that this is more severe? Because, I mean, I can't find my wallet half the time or my keys and whatnot.
Well, it's when you forget what your keys are for.
Okay, got it. That makes sense.
Yes. That's a good sign that dementia is setting in.
Yeah, most definitely. Or if you forget something that, you don't want to endanger other people.
Sure.
Leaving the stove on.
Leaving the stove on is one as well. Just familiar tasks.
Yeah.
Dishes, laundry, forgetting where dishes go in the house when you've been doing it for 20 years.
Or if you drive to work every day for 20 years and you find yourself lost.
Yes.
Okay.
Good
Difficulty planning or solving problems.
Just planning, just daily tasks.
Okay.
Getting up in the morning, you forget what the proper, taking a shower and getting dressed is.
No, we
all
often, I'll sit here and go, let's say Thursday or say Wednesday.
Right.
But it's forgetting time periods, correct?
Like who the president is.
Yeah.
That sort of thing.
While we're on this, dementia, and I know it's going to be a whole different avenue, Alzheimer's and whatnot, there are similarities to that as well, correct?
Yes, yeah. Dementia is kind of a cover-all for all memory issues.
Okay, got it.
Alzheimer's being one.
Okay, let's talk about depression now, because depression, I imagine you have some of the very similar symptoms, but is it easier maybe to get out, not easier, but are there ways to get out of depression and treat it better than you can dementia?
Depression is treatable, whereas dementia is not. And dementia or depression can be things like not wanting to do activities. Going to bingo, social activities, you kind of become withdrawn.
You're not forgetting about going, you just don't want to go.
Irritability can be one. Those sort of things. Just
no interest in things that you've enjoyed for years, and all of a sudden, like you said, bingo.
Sleeping habit changes.
Decreased energy, fatigue.
Yep.
But some of that can get confusing because, that could be diet, that could be a lack of exercise,
and it could be, and you're right. And none of these are definitive.
Yeah.
It's if you think depression is part of it, you might want to talk to a doctor about it because it is treatable.
Yeah, insomnia, waking up early. Excessive sleeping.
Yeah.
Doing this shift, I feel like I'm depressed now because, love it, but man, you're always tired waking up early. But that's where you have to do a checklist. Okay, you know what? If your job calls that you're working third shift, sure, you're going to be tired. I mean, that just goes with the neutrality of the situation.
Well, and you know your parent better than anyone, so you'll notice changes in their just their attitudes.
I remember my grandfather, it was dementia, Alzheimer's primarily, but he would often forget your name. You just talked to me 10 minutes ago, but he'll tell me something that President Reagan did in 1982.
And that's common with dementia. Yes, exactly.
It'll be like a long, big blank out, and then anything from 82 before, he would be able to call on a dime.
That's very common.
Yeah, very good. Thanks so much, Roger.
Well, thank you. Thank you for having me.